Okay, welcome to the Cosmetic Cast. I'm Vicky Eldridge and I'm here with Hamilton Fraser's founder and CEO, Eddie Hooker. And we're also joined today by our special guest, Dr. Vincent Wong. We're joined today by Vincent because we're going to be talking about, for Pride, June is Pride Month, we're going to be talking about the LGBTQ plus community, particularly transgender patients, and how we can be more supportive and more inclusive within our clinics. And I'm really delighted to have Vincent on the show because he is a long-term friend of mine, somebody I've known for many, many years. He's a multi-award-winning facial aesthetic doctor specialising in facial balancing and harmony, and he does a lot of work in facial feminisation and masculinisation as well within the LGBTQ plus community. He's been shortlisted as one of the Ultimate 100 Global Aesthetics Leaders and has been a trailblazer in advocating for the community. His personal experiences with discrimination have fuelled his passion as well for creating a more inclusive and supportive environment in aesthetics clinics. So, Vincent, we are delighted to chat to you.
Excited.
Thank you for having me.
To me, I am going to learn so much, and I think such an important subject, both in the community, both in aesthetics, but both also for the insurance world, from a risk point of view.
Absolutely.
So I can't wait.
It's going to be a fantastic
and also I'm going to be in awe, Vincent.
No pressure.
You're super, so if I don't say anything, it's only because I'm starstruck.
And he's such a super nice guy as well, Vincent. He really is. He's a lovely, lovely guy, as well as being such an amazing doctor. We mentioned in the introduction that June is Pride Month, so we're talking about Pride. But what does Pride mean to you? And how can clinics acknowledge it and show their support in the community in a meaningful way?
For me, Pride is about celebrating who you are without any boundaries. So there's no, skin color doesn't matter, how you identify doesn't matter, your sexual orientation doesn't matter. It's just celebrating who you are and living life in that moment. And I think in aesthetics, it's actually not as difficult as people think to be inclusive. I think a lot of people have this fear that they might say something wrong or they might do something that shows a bit of bias, but in actual fact, it's actually really easy. I think one of the key things is surrounding pronouns. So simple things like, being open and, speaking about pronouns, being comfortable in that conversation is a good start. Bearing in mind that a lot of people who want to have aesthetics procedure done from the LGBTQ plus community, they're probably quite nervous to begin with because you hear so many, bad stories, horrible experiences, people who have a phobia towards the community where things have gone wrong and things like that, or just the lack of understanding. So bearing in mind that, this group of patients or clients are already very nervous to begin with. So if you just make them feel comfortable, and sometimes we make mistakes, right? So as long as you apologize and explain, that you made a mistake, and we are generally quite forgiving.
Do you think the business community just jumps on
the pink pound.
Because my experience from certainly in the insurance world, and that's where I've been for the last 30 odd years. So you sometimes get the feeling that people are just, it's Pride Month, so we're going to change the colour of our logo. We're going to just make I'm not going to use the word political statement, but they use a statement. And I sometimes worry that I don't think people understand. I think it's just a gimmick for some
100%.
Do you find that when you're...
Yes, a lot of businesses just, as you said, have this rainbow flag in June, July, sometimes not August, and then that's it. And I think it is it.
Exactly. Yes. That's a calendar date, like your birthday. So you're going to do something, and then they don't do anything after that.
In a way, it's progress, but at the same time, we also need to remember that the community exists beyond this month. So it's
we don't come out
exactly and just be there, and then we disappear again. So it's important to do. Even if it's just something small, like continuously throughout the year, I think that's where you can differentiate a business or someone who's really supporting community versus someone who's just doing it for whatever reasons.
Yeah, absolutely.
Where do you think sorry, I interrupted you there. Where do you think the industry has improved in recent years? So we mentioned that people are, I think, becoming more open to conversations.
Yes.
But where do you think we're still falling short and where there's gaps that
I think one of the biggest things that I've seen would be a different price list for female and male patients, especially when it comes to like things like hair removal and things like that. And I think that is probably one of the first things that need to go.
I didn't know that. Is that
really?
A practice?
Yeah.
Quite common.
Very common in the UK.
Wow.
Yes. So they generate, even for certain injectables like toxin, some people would charge more for male patients because obviously male patients, the muscles are a little bit stronger. They require a bit more. But I think businesses need to really take a sit back and then think about how you can have one price list, which is more inclusive and not having that differentiating factor.
Does that cause concern to the male population? They're thinking why? That's quite a good technical point that the muscles are stronger, so therefore you might need a little bit more product.
Yes,
but is that explained to?
Generally, I would say yes, it is explained. But then the issue really is, especially when someone is in the process of transitioning, then do they go for a male price list or do they go for a female price list? Especially like, in the early stages of transitioning, misgendering is quite a big issue and can cause a little bit of psychological trauma and things like that can be quite upsetting. So, someone may still look like a man, but then they might identify as a woman, and then having that price is just going to create some unnecessary...
This is quite important to me because obviously the theme of the running story theme under all the podcasts we're doing is talking about safeguarding and talking about mental health and those sort of things. Do you think the aesthetics industry is recognising the LGBT community and putting the right safeguarding procedures in?
Yeah, I think overall it is improving compared to what it was probably even 5 years ago. But there's still so much work that we can do. I mean, how many aesthetics clinics that we know that actually work with a healthcare professional for even normal patients, so to speak. It could be someone who probably just had a divorce or some major incident in life. They may want the treatment, but then they may not be in the right mindset for the treatment. And the same can apply to the LGBTQ plus community. So until, it becomes standard practice, it's difficult to see that amount of improvement that we want to see. And
I guess true inclusivity is that will be the case for all patients.
Exactly.
That everybody will feel welcome.
Yes.
And I think very much we're moving into more personalised treatments anyway. 100%. So this idea of this price for that and this price for that, there should perhaps be a spectrum of prices that it will depend on your individual needs.
Exactly.
And then you're not then putting people in a basket, are you? You're not putting them on under this label or under that label. And I think we're seeing more person. I don't know if you're seeing that from the insurance
Well, we
side.
are from, obviously we do, one of the requirements of insurance in this industry is the consenting process. And our last guest, we had this debate really about how much time do you spend, you mentioned having health and mental well-being being at the forefront of an offering an aesthetic business. We are starting to see much better communication. The consenting process is moving away from that tick box sign here to a much more inclusive, what's your social background, what's your sexuality, what's your... I think a great comment you made there, what's the trauma in your life?
Yes.
Because it doesn't have
Whoever
to be...
you are.
It doesn't have to be gender or anything. It could be the divorce, it could be I've moved house, it could be...
bereavement.
I've had cancer, and I'm recovering, and that sort of thing. So I think we are getting better.
Definitely.
I think there's a lot more we could still do. I think in the industry,
100%.
to have a lot more of that open communication before each
Yeah, absolutely. And actually, we just touched on trauma a little bit there, and you've written a novel, haven't you? You're a very multi-talented man. Called Healing Scars. I know, yeah. And that's your own story. It's based on your own story,
Yes,
isn't it? It's a fictional thing, but it's based on your own story, your own experience of coming out and dealing with trauma.
Yeah.
Can you tell us a little bit about that and why you wanted to write that?
Okay,
that book?
So in that book, everything that you read has happened, but obviously I had to group a few people together and make it one character and then move the timeline a little bit so it makes a bit more sense. Cool. But the reason why I wanted to do it was because my coming out story has been quite traumatic. And, in lockdown, I kind of decided that, I want to put everything down on paper. It's quite therapeutic for me. Yeah. So, I'm doing it kind of for my own benefit. And I remember speaking to someone who kind of helped me polish a whole thing to become what it is at the moment. And he was saying that, you probably end up with a very expensive manuscript. I'm like, okay. But then for me, it wasn't so much about promoting it or making money or anything. I mean, that would be amazing. Yeah. But, if it makes a difference to someone going through something similar that I've been through, then that's more than enough for me. And that's in itself very rewarding, I find. So that's why I decided to put it all down together.
What was the hardest bit? Do you mind me asking?
Was
there one moment that you suddenly thought, wow, I can't believe this is the action?
Yeah. The one moment would probably be when after I came out, my mum didn't accept it to begin with, and then that led to a huge family drama. So my mum was away. I was very much on my own at that time, with like dramas going on with my siblings and things like that. And I went into this situation where I struggled financially to pay for my own tuition fees as an international student. That was probably the moment where I'm like, oh my God, how did I do that at the age of 19, 20? Like, how did I overcome that?
Yeah, absolutely.
Yeah.
I think family issues probably in my book would probably be, I would imagine, would be probably the hardest bit.
Yeah.
Do you think that was an age issue for your parents? That they were more, what's the right word? More old school.
Yeah.
Or lack of understanding, because I think a lot of it's understanding.
Yeah, I think it's a mixture of everything. Lack of understanding, the cultural background and things like that. I mean, me and my mum are okay now. Like, our relationship is better than ever before. But I think for her, I think for a lot of parents as well, you always want what's best for your kids. And I think in her mind at that time, the best thing for me is to be straight.
Yeah.
Yeah.
Absolutely.
So, because she didn't know any better, and she wasn't exposed to, the community or successful relationship stories from the community. So in her head, that was the best that she could do for her kid, and that's why she was fighting for it. And then I think the key turning point for her was when she finally realized what I went through, and then she was like, oh my God, like, me wanting the best outcome for you has actually led to a lot more stress, and that's when our relationship started to improve.
Yeah, it's really what strength. And how did you bring that into that experience into your practice?
So for me, when I treat patients from the LGBTQ plus community, that is one point that I can connect with them, because a lot of members of the community have been through some sort of struggles, and that we can always relate to one another. And sometimes, because I also do some charity work as well, so sometimes I see patients who have been through kind of similar issues with their family. So then, I can share with them my experience, and then also pretty much reiterate what I've just said, like, try to think of it from your parents' point of view as well. With time, in my case, I was very fortunate that with time it did improve. But then at the same time, you also need to be more independent in case that relationship never improves. Because we don't know, we can't predict that. So I think some of them find my story quite motivating, which is more than enough for me. And that is very rewarding, and that also builds a rapport that's so important in this field. Once they trust you, once they know that they're in good hands, then, even if you make a mistake by accident, say the wrong thing or whatever, they're a lot more forgiving. Yeah.
I remember one of the things that you were talking to me about was about the gaps in accessing healthcare.
Yes.
Something I just didn't realise. That I know we went to a fabulous event and you did your I Am Me campaign years ago, and but you were talking about that your own experience there as a medical student trying to access support or medical services. That there were these gaps that people were experiencing, and that's something I wasn't aware of.
Yeah, it's quite a common thing where we don't necessarily get all the healthcare, whether it's aesthetics or some other things that we need. I mean, look at simple things like PrEP. How many people are struggling with it to get supply and the pricing of it and stuff like that. It's a lot better now, but then give it 2-3 years back, that wasn't the case. And it's something that can really benefit the community and general public in general. And something simple can be I just feel like there are a lot of obstacles, a lot of hoops that we have to jump through.
Is that are those obstacles and hoops to jump through? Do you consider that prejudice or lack of information? Ignorance, is that a good word?
Think it's more lack of understanding and ignorance. Yeah. And we've come a long way in the last decade or so, but then there's still a lot more that we can do.
100%. There's a lot of debate also, isn't there, about and do you see issues with gender versus biological difference?
Yes.
And it's topical in the news at the moment as well.
So much so,
What do you feel?
And I think a lot of people get confused between sex, gender, and sexuality. And, when I go to clinics or when I do the LGBTQ plus course that I do, that's one of the key things that I really focus on. So your sex is, when you're at birth, whether you're male or female, and gender is how you identify. You could be a biological male identifying as a female, a male, or none at all. So that's why we have, non-binary and things like that. And, with that, it links back to the pronouns thing that we were talking about earlier. So it's he, she, they, or them, And these are important things that, once you show understanding that you know what you're talking about, then all the fear, all the awkwardness just melts away. I think it to me it's more about education. Exactly.
And,
yes.
Even I feel, and we said this when we were chatting before we went on air, is I just personally get very nervous about using the wrong terminology, and then you think, oh, what have I?
Everyone does, don't you? You don't want to upset somebody.
So then you start pussyfooting around the hole, and then you dig yourself a deeper hole.
It's even worse.
Why did I even start?
Even I've been in that situation before.
And I remember you saying to me, it's about just sitting down and having that honest conversation. Why is that so important? To say to people, what are your preferred pronouns? How would you like me to address you? And, and you can ask that, can't you?
Yeah, exactly. So the normal way I do it is, hi, I'm Vincent, my preferred pronouns are he, him, and what yours are. And that's a perfectly simple and acceptable way to break the ice, so to speak. And, you'll find that it's amazing how, people just connect instantly. And then based off of that, then you could always say something like, we're going to go through your aesthetics consultation, we'll see what we can achieve. But if I suggest something that doesn't fit your beauty goals, please let me know. And then you have that understanding from the get-go.
Just being honest and communicating with people, because this is the thing, isn't it, that we fear so much about saying the wrong thing that as you said, that can then make it even worse. And just saying, do you know what, I actually don't, educate me, let me know, tell me where you feel comfortable, or tell me where I've, because I think most people fundamentally, I'd hope, maybe I'm being naive, most people fundamentally want to do the thing, don't they? They want to be kind, they want to be inclusive.
At the end of the day, it's how I look at it. People are people, aren't they? And, whether you're gay, straight, you identify differently, at the end of the day, if you're a nice person, you're a nice person. If you're a horrible
100%.
person, you're a horrible person, in my view. And
100%.
I want to treat everybody in the same, as I would want to be treated, to be fair with you. You with me? Because you can have prejudices if you're straight, no different than you can if you're black or any other part of the population. So I do think, it's about education. It's about being yourself, and it's been about accepting. You with me?
Definitely,
and I think that is really, really important. But I don't think you're naive. I think there are pockets of people that do not see it that way, and that's the prejudice, which you're not going to break down, however much.
Yes, and do you have it in the other way? I mean, obviously, a lot of the patients that you see will be, coming to see you specifically because they know that you understand their community, that you're going to be somebody that they can come to and feel safe.
Yeah.
But do you get other patients where you might mention pronouns and they're a bit standoffish about it? Because I think some clinics might be worried that, that a patient will come in that doesn't relate well to that. And that might be another fear in doing the right thing in the situations where they should be asking about it. Does that happen?
It has happened so many times. Even some people that I've worked with in the past have been like, oh, you shouldn't really be talking about pronouns. I'm like, really? Welcome to the 21st century.
What stone did you come out?
Exactly, right? Some people, like I've spoken to sort of like some business owners, they were like, oh, we're not sure about this whole pronoun thing because it might not fit with the type of clientele. I'm like, what clientele are you talking about? Like,
humans.
Yeah, humans, right? So, it's a tricky one. And also, I think the biggest challenge when it comes to patients it's more like a cultural thing. So, like, say, for example, you have a patient from Asia or Middle East, then, where homosexuality is a death sentence. So, they may not feel comfortable talking about anything remotely to do with LGBTQ plus community. And anything with pronouns or sexuality, they just shut off completely. And I think the way that I counteract that is with sort of like email signatures, Instagram. I always have my pronouns there so that it doesn't come as a complete shock when we have that conversation. If they are not willing to talk about it, then okay, fine, we can continue other ways, but then I always include that to begin with.
Yeah, it should be an option for people who want to talk about it, and equally not,
exactly.
People who don't
You
want
have
to
be fair on both sides, so to speak. Yeah,
that makes a lot of sense. Are there any other ways we can be more inclusive within our clinics? Anything else that you feel that people could be doing?
So many things. It's just, I think having a good understanding of what you can do to help your patients is probably the key thing in all of this. Yes, we can talk about, the whole pronouns thing, marketing thing, having, a gender-friendly color and stuff like that, and marketing material. But I think the most important thing is to have the understanding and be open-minded to things. Yes, we have very typical feminine and masculine looks that we can achieve using surgical and non-surgical treatments, but then some people might want a mixture of two together. I think we, as an industry, we are entering an era of personalized beauty, so that is more, fitting with what your clients want, what suits their character best, rather than having this structured, this masculine, this feminine.
It's a very interesting point you make there, Vincent, as I'm listening intently to you, is that, and I think even Hamilton Fraser fall into this trap, that if you look at our marketing for our cosmetic insurance, and I try to think we're a little bit more than just insurance. I think we take quite a big interest in the wider sense of the aesthetic market. But even when I look at our pictures, it's very stereotypical of, the young, pretty woman. You with me? Now, obviously, what I wouldn't want to suddenly do is make a massive big statement and go the completely of a young man, so to speak. But we don't tend, I think the industry still has this view of aesthetics being for that perfect looking,
Yes.
fantastic. I mean, I'm going to ask another question because you were a judge at Miss Universe.
Yes.
I actually want to ask about that. But do you get my point? It's that.
Yeah.
Whereas I think to be more, not the word inclusive, but to be more open, I suppose. I think imagery in the sector.
That's changing,
Yes,
definitely.
100%. It's all about
Move a bit
visibility.
more.
It is, yeah,
Yes,
definitely. As a
yes.
magazine editor, we had, and you would see it all the shows. There was the same Shutterstock woman who actually probably wasn't even old enough. Yes, they did. She wasn't even probably old enough for aesthetic treatment.
Oh,
You're
my
talking about
God.
someone in their 20s or 30s that was used, and actually
Absolutely.
most people having treatments would be, the biggest group of people having treatments would probably be women 40 plus,
Yeah.
and that wasn't even represented in images. And if you searched for it, you'd get, on the stock libraries, you'd end up getting some fuddy-duddy looking, and I was thinking, hang on, I'm 40. But that has changed now. There's more body types, more different
Yes.
body types.
Absolutely.
There's more diversity in terms of ethnicity. There's more
Absolutely.
age diversity.
Yes,
and now
definitely.
you've got that in the libraries that are available for imagery. I've noticed in the magazines that I work with that is starting to change, and there is a bit more
Yes.
diversity there.
Yeah.
But you're right.
Yeah.
However many years ago as well, there wasn't even the images available. You couldn't
yeah.
find them.
Exactly,
So you
yeah.
definitely couldn't find.
Yeah. And I think that's quite tricky to make it perfect, because visibility is not just, okay, well, we're talking about LGBTQ plus community. It's not just, having a gay couple or a lesbian couple. Like, each letter in the LGBTQ plus, LGBTQIA,
Yes.
each one has to have its own visibility, and it's difficult from a business point of view to include everything, right? Yeah, but at the same time, it's about getting the right balance, I think. Yeah.
And actually, can you go through with us what that means? Because I actually think that a lot of people don't know, and I will admit that when you said I don't know.
Lost after the Q, actually. That's
Okay.
where I get to, or the T.
Right.
But,
I'm probably not the best person, but I will try. So L is for lesbians,
Yeah.
G is for gays, B is bisexual, T is trans, Q is queer, I is intersex, A is asexual. Yes.
Is that
But within-
sorry, again, is that because that's where the plus comes
Yes,
in? Because
exactly.
you can add other groups.
Absolutely.
different-
And then within each group, there are subgroups as well.
Yeah.
So it gets a bit complicated.
Yeah.
Yeah.
And I think that's another way people come undone, because they think, I don't understand.
And I
don't
can
wanna
see how
ask
it's
'cause I'm
scary.
embarrassed to
Yes,
ask.
exactly.
Because you think, well, I should know, and I don't.
Yes.
And I
Yeah.
think that's one of the things.
I mean, I think, coming from, I'm 57. There, guys, I know you think I'm a little younger. Obviously, coming through the 70s and 80s, where there was a huge amount of prejudice.
Yes.
And growing up, all I ever learnt was the gay community, and then suddenly you end up with a lot wider group.
Yes.
And I agree, Vicky. I think sometimes that's where people start getting tongue-tied, and then start
Exactly,
getting embarrassed as they
yeah.
start trying to, if you get it wrong,
Yeah.
LGP, and then I find that myself. So I resort to the gay community,
Yes.
but that's probably not the right thing, is it?
Yeah. Even terminology, like when I started the IME campaign, I kind of started using the word queer, and then some people were like, oh my God, it's so offensive. I'm like, it's not.
Reclaimed, isn't
Yes.
it?
Was in the 80s.
Yeah,
That was-
exactly.
That was if you wanted to
Exactly, yeah.
pick on someone.
Yeah.
That's a terminology, a horrible word in back in those days.
Yeah,
But
yeah.
now
It's
It's
acceptable.
an empowering term,
Yeah.
isn't it?
Yeah.
you've been working with Jackie Knight.
Oh, yes, I have. Yes.
A new
I love her.
clinic in Brighton.
Yes.
So the point there is makeovers for the transgender
Gender,
patients. Talk a little bit about how you're working
Okay,
there.
cool. So Jackie has been an amazing supporter of of all the work that I've done with the LGBT plus
Fantastic.
community, and Brighton, being the LGBT hub, so to speak, for the UK, and also it was the first place that I went to when I moved to the UK. So I did my A-levels in Brighton.
Did you?
Yeah,
Oh,
I
lovely.
did. So it was like a really nice thing to
Brighton.
go down and, to work with Jackie. And we do a lot of like work for the transgender community, mainly surrounding sort of like non-surgical aesthetics. So we kind of like showcase, what we can do. So it could be a combination of different treatments, and people from various backgrounds and different stages of the transition process, which is quite rewarding, because how you treat someone at the early stages of transitioning is completely different to treating someone who has been doing it for 8-10 years. Yeah, so it's about doing the subtle changes to begin with and having a more dramatic impact at the end. And also, I've learned so much, like, the whole misgendering, how hormone therapy actually affects the soft tissue, the distribution, your skin quality, what kind of skin concerns they may have or they are going to face further down the, path. And yeah, it's just been really, really rewarding.
It must be, because I know you said that with non-surgical treatments, this is where they really play a part, don't
Yes.
they? Because they can help someone realise their identity in a way that's reversible. Because,
Yes.
I know that you've spoken to me in the past about how someone can start to go down a road of changing their appearance, and then
Realise
if
it's
they're
not
not
for
happy
them.
with it, then you don't want something permanent, do you?
Exactly.
And non-surgical treatments are
Yes.
perfect.
They're ideal, yes. Yeah.
And I think also that's quite a good entrance into this subject, because also you have a lot of talk about is the LGBTQ plus discussion happening too young for people that are too young.
Yes.
And I know that schools are struggling. Some schools
Yeah.
are struggling. So having a makeover, so to speak, to me feels the right thing to do, rather than jumping straight into
Surgery, gender reassignment and stuff like that.
Absolutely. And I think that's something which, do you think that will grow, that sort of approach?
100%, yes, definitely. And the thing is, I always say that transitioning journey is almost like, it's a journey, okay? It's not about, your starting point and end point, and there's just one route you take.
Yes.
You can
Yes,
take
I
so
agree.
many different routes, and sometimes you decide that actually you don't want to go to the end route. The end destination, you're just going to go back to where you started and go somewhere else,
Yeah.
and that's perfectly fine. And with the benefit of having non-surgical is that, it doesn't last forever, and that you can reverse it. And it just provides a safe environment for people who want to try, who are really serious about trying it, to have a go and then see if it's for them.
Yeah.
Are there any educational facilities or opportunities for practitioners to learn more? I mean,
Yes.
this to me is fantastic. I'm learning, and I thought I knew quite a bit, but I'm learning so much. But is there more opportunity for people to learn more?
Yes.
Practitioners to learn more?
Absolutely. So I run training courses on the subject masculinization and
That wasn't a plug,
feminization.
but
Yes.
go for it.
And also I'm working with Antonia on a one-day conference called Transmedica. So we're working on
fantastic.
launching
Safety and
that.
beauty.
Yeah, it's a Safety and Beauty. Yes.
Fantastic. And you're writing a textbook as well, aren't you?
Oh yes, I forgot about that.
Yeah. I remembered it because it's in my notes.
Yes.
So we'll put those details on at the end,
Thank
because I
you.
think it is so important that this subject is given the exposure, but also the sensitivity that needs
Yes.
to go with it.
Because you can do so much positive, can't you, for people when you're
100%.
providing treatments.
Yeah.
And I think one of the things is that people are frightened to get out of that masculine, feminine
Yes.
treatment. And even, I remember I was at a talk in IMCAS about this, but it was, not IMCAS, AMWC, but talking about how actually some of the most beautiful women in the world, and this will lead you into your Miss Universe.
You're prepping
I'm
me up
prepping
here.
you, but have got what we would traditionally call a masculine jaw, a square jaw,
Yes.
Angelina Jolie and people like that, who've got features that perhaps we would put them in this box. Oh, that's a more masculine feature, and that's more feminine. And actually, those definitions of beauty don't really exist, do they?
Yes,
Because,
exactly.
I mean, I think most people would say she's one of the most beautiful women in the world.
Exactly.
And she's got that.
And
as
some
a
people think that
feature.
having a strong jawline is actually quite, shows that you're confident, you take charge of things. There we go.
Go on then, ask about Miss
So I'm
Universe.
so excited about it. So Miss Universe Great Britain.
Yes.
So how did you get involved? And can I just ask, what is it like to...
Okay.
I'd heard of Miss Great Britain, I'd heard of Miss World,
Yes.
but Miss Universe.
It's another whole level.
Oh,
How did you get involved?
can there be more good-looking people out there?
You know what? Like growing up, Miss Universe was probably the only pageant that I knew, and then because I was growing in Malaysia, so in Asia, in Asian countries, like pageants are quite big. I think the biggest one was Miss Universe, and then when I moved here, I learned about Miss World, and then there's also Miss Galaxy.
Oh wow, Miss Galaxy.
Yes, there
Is that slightly down from
I've
Universe?
got no idea.
There's Miss Tourism.
Wow.
It's a lot of pageants, and I was just like, oh my god. So I first went into pageant because when I started, actually the first few people that I've treated with toxin and fillers and stuff like that were pageant girls. And, they're obviously very beautiful to begin with, but then it's just a little bit of enhancement here and there. And I'm mainly treating skin quality and stuff like that. And through that, I just made more and more connections in that world. And then the first judging role was actually for Miss London, for Miss England, which goes into Miss World. So I really enjoyed that. And then I started working with Amy Willerton, who was probably, in the history of Miss Universe, the second best representative we had from UK. So at that time, I was helping her improve her skin quality. Not that she needs a lot of work, she was beautiful to begin with. And then she went into celebrity getting out of here, and her career really progressed. And it's actually quite rewarding, to be involved in that journey. And and I spoke to the organizers of Miss Universe, and then they were like, oh, do you want to be the official aesthetics doctor for Miss Universe? I'm like, oh my god, I would love that.
Fantastic.
And even at that time, I didn't know much about pageant. I follow it to an extent, but I don't know the ins and outs of it. And I actually had a very different idea of what it would be. Yeah, because you just think, beautiful women, blah, 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 and it's all about the exterior kind of thing. And then I got asked to be a judge. And then I was like, okay, cool. How difficult can it be, right? Oh my God, how wrong was I? So it's actually quite difficult because you're looking for someone who, has stage presence, someone who will make people turn their heads, and at the same time, they have to do, they have to do charity project, they have to raise certain amount of funds, and then and then you need to know stuff like what they're going to do with that title, because in all all points considered, it's actually a full-time job, because they get, if they win Miss Universe, then they get a contract, so they get paid X amount every month, and then they have to do all these things. And you make sure it's an actual job.
An ambassador. So that's fascinating, because that was one of the questions I was going to ask. Because beauty is very much in the eye of the beholder.
Yes.
And I would have imagined, and you've just confirmed that actually it's not just about looks.
Yes, exactly.
It's about a whole package.
Yes, brain, beauty, personality.
There was those jokes about world peace, that they this congeniality. But and that's what you see about pageants, isn't it? You just see that sort of side of it where they go, and world peace.
Exactly, yes. And then, the interview rounds are usually the trickiest part, because this is the moment where you see the contestants for the first time, and they're probably getting ready, so they're not in their best, aesthetics appearance or whatever, but that's when you really get to know them, because you ask all the questions and then you judge based on their answers alone, without looking at them, so to speak. Oh,
it must have been fascinating.
The first few times I did the judging, I actually cried. Because some of them, like, you always ask, like, what's your motivation behind this and stuff like that, and they tell you their story, and oh my god, some of the stories I heard, I was just like, wow.
Amazing.
I think I'd be in tears. But actually, that's quite good. I like.
It's nice to be emotional. I think, and it shows that people care about something.
Exactly.
Doesn't it?
Yes.
Absolutely. Amazing.
Vincent, absolutely. This did not disappoint.
Thank you. Thank you.
It's been so lovely talking to you, and I've learned so much. And hopefully, others listening in and watching will have the same feeling. So thank you so much.
Oh, thank you for having me.
Us.
It's been a pleasure.
Yeah, thank you. It's been so lovely. Always
thank you.
lovely to see you, but lovely to have you on the podcast.
Oh, thank you. Thank you so much.